Yes, thank you very much. We are very happy to be hosting the CEPI, and it's important that you know this the National Institute of Public Health and the CEPI are two different organizations, even though we are located in the same areas. I think some of the questions we want to ask today is how can we as a National Institute, together with CEPI and other research groups, Norwegian research groups in collaboration with the international networks, contribute to research in this area. And I do not have the answer to that, and I will not answer that in this presentation, but I think we can discuss this further on today, and that will be one of the important questions today. I just want to remind you of the visions and national goals for Norwegian public health policy, better health for all, and also remind you on this bullet point: Norway shall contribute to better health globally, which is also an important goal for the Norwegian Institute of Public Health. A short overview of the Institute today. We are about 950 people working there, and we have 4 divisions. One division of mental health and physical health, one division of infection control and environmental health, a division of health data and digitalization, and a division of health services. And I think it's important to see that the Institute have a lot of competencies that can be relevant for further cooperation and research. We have a lot of knowledge related to health systems and global health, which many of the activities in this division for health services and also in our division. We also have a lot of competencies in infrastructure for research and infrastructure for epidemiology. These are the core tasks and areas of expertise. That is how we are presenting them today. And one of the core tasks for our institute is preparedness, both national preparedness for infectious diseases and other diseases, but also global preparedness. We have a relatively high activity in research and health analysis. We give a lot of evaluations and advice. We have services with the infrastructure, and it's also important for us how to communicate, how to interact with the community outside the institute, and both in a national aspect and also internationally. In our division, we have a developmental strategy where we have, for the time being, great emphasis on how to improve the input of data, how to get the right data that are relevant for to solve our tasks. That includes more advanced laboratory methods. For instance, we are now basically using whole genome sequencing to characterize the bacteria and viruses that come into the laboratories. We are developing the networks that is important to solve our tasks, and also improving how to use registries in our daily work and in research. And this makes it necessary to develop further competencies and knowledge in how to analyze data, both big data, epidemiological data, and new sources of data. And we are building up the bioinformatic competencies, the biostatistical competencies, the epidemiological competencies, and mathematical modeling. And I think that will also be important as platforms for some of the collaborations that could be possible between CEPI research groups and our institute. And we do that not only in our division, of course, but we also use the network within the institute and the network between the institutes and other relevant institutions. The epidemic intelligence and the competencies in epidemic intelligence is one of the core tasks in the institute. Of course, I am not going through all this the whole slide, but just to remind you on the event-based surveillance and the indicator-based surveillance, and that even though most of our concern is a national concern, how to have a good intelligence service for national purposes, we have and we use international sources to solve this, but we also have a global role for this activity. So the public health surveillance and outbreak response, establishing, strengthening and coordinating population-based sentinel and syndromic surveillance systems at country and regional levels, technical expertise in communicable diseases, especially vaccine preventable diseases. We have experience in low and middle income countries, in particular, Afro regions. Several of our employees regularly go to these countries and work there. And we have, I think, a good experience in event-based and indicator-based surveillance, as I showed you on the previous slide. Epidemic preparedness and response and epidemic intelligence and outbreak investigation expertise are some of the things that we would point to that could be valuable experience and knowledge and competence in the Institute. There is, of course, a discussion in the Institute what is our main mission? Is it to work with in the Norwegian context or more globally? And of course, we also have a global what happened? We want to contribute in the global work and support and encourage new international initiatives to strengthen infectious disease preparedness and prevention. The collaboration with CEPI is one example. The work with the Global Health Security Agenda is another example. We have been asked to participate in several other vaccine-relevant projects, as the Human Vaccine Project and others. We are working with the burden of disease assessments in collaboration with other institutes, assessment of risk factors and vaccine uptake, clinical trials, evaluation of vaccine impact and effectiveness. We are establishing advanced mathematical and statistical modeling and knowledge about attitudes, practice, surveys, and how to implement interventions in several types of populations. And we also have, as you know, a Center for Systematic Literature Reviews that are very important for how to solve the tasks. We have experience in project management, strategic leadership and execution of multidisciplinary international research, experience in management of national and international cross-functional multidisciplinary teams, includes health workers, health authorities, funders, international agencies, and non-governmental organizations. Some of the key competencies in the Institute are the laboratory-based infectious disease surveillance, also vaccination during emergency settings, infectious disease modeling, biostatistics, bioinformatics that I already mentioned, field experience in low and middle income countries, cost-benefit assessments, and product and preclinical expertise. So I just want to conclude with we have no, I can't tell you today how we should make this participation with CEPI and other research group and research group most effective. But there are several international initiatives in this field. We could have a role to coordinate Norwegian coordinated initiatives. We could contribute to the development of further development of existing centers of excellence. We could participate in global studies aimed at prevention and control of disease. And we could try to facilitate applications to accelerate product developments of major diseases. So I think I just end there. Thank you.